The last time I filmed, it was a few years ago, and since then I have been able to live much more of a normal life thanks to Dr. Joshi and these ketamine infusions. I've been able to start college, been able to move out of my parents' house, and I actually go to school in a different state now. I've really gotten back some normalcy of a life without CRPS. Unfortunately, CRPS will always be there. No matter if I'm feeling great and in remission, it's still in my body. And over the past about month, I've been in a really bad flare. I've tried the regular ways of coping with a flare. I've tried pain medication, I've tried relaxation, meditation, but really the only thing that gets me out of these flares are these ketamine treatments. I don't like them. They're not the most pleasant treatments to have. Being 3 hours under ketamine and then basically sleeping for 2 days, might sound great, but it's not. I don't know who would choose to be here over being with family or being with my boyfriend back in Kentucky. I don't know who would do that, but this is the reality of it. You have to do what you need to do, and thank goodness for doctors like Dr. Joshi who do these ketamine treatments, because my flares just would continue on if I wasn't able to do them. So this is what my feet look like today. They look completely normal, but that doesn't mean that CRPS is not, that doesn't mean I'm not constantly in pain. 7 years ago when I was diagnosed, you would have seen redness, you would have seen blue. My leg did look dead, but now that I've gotten my life back and I move more than I ever have in these 8 years I've been diagnosed with CRPS, I have gotten not normalcy in my life, but normalcy in how my feet actually look. And for anybody, for any expert, any doctor who says that your leg has to look a certain way or has to be completely dead in order to be diagnosed with CRPS, you are wrong. And that is an ignorant thing to say, because you could never live a day in the life of a CRPS patient and what we have to go through and the scrutiny that we have to go through, because people think we're imagining it. My legs look fine, but they hurt every single second of the day. Nobody would imagine that. Nobody would pretend. Nobody would want that and want that in their life. There's not a single sane person in this world who would want to be in pain like CRPS patients are. So for doctors who say that we imagine it, screw you.